Hey, Margie here. Are you ready to learn some amazing exercises you can put into your life to build bone as well as improve posture, reduce the rounding in your upper back, and so much more? Well, if the answer is yes, you are in the right place because today we're going to focus on exercise and osteoporosis. And we're going to talk about what really works and how we can safely and realistically add bone building exercises into our lives. I'm so excited about our special guest, Dr. Sherri Betz. And Sherri's a good friend of mine, a board-certified clinical specialist in geriatric physical therapy and the director of TheraPilates Physical Therapy clinics, specializing in osteoporosis and geriatric orthopedics. She's a frequent international conference presenter, and she hosts streaming lectures, bone-safe movement classes, and webinars. And Sherri's been involved with exercise and osteoporosis for over 30 years. She's the therapist who teaches the therapists as well as the physicians. And in today's talk, not only do we discuss concepts, but she also demonstrates these fabulous exercises. And there's just so many great takeaways from today's episode that I can't wait to share this with all of you. So stay tuned. Welcome, Sherri. I am so happy to have you back on the podcast so we can really update everybody to the latest and the greatest. And there's just nobody better to do this than you. So thank you so much for joining me here today.
Thanks so much, Margie. I just think it's amazing what you're doing here and spreading the word on safe and effective exercise for osteoporosis and all things bone health. But my focus is always on exercise, and I love it any chance I get to talk to you, my bone health bestie, on exercise for osteoporosis. So this is going to be so much fun.
Yeah, for people listening, Sherri and I have known each other for such a long time. I mean, both of us have been I've been doing this over 25 years. Sherri's been doing this over 30. And I remember first meeting you at one of the osteoporosis conventions way, way, way back. And we just saw each other recently. So we always have a great time together. But both of us have a lot of experience with exercise and osteoporosis. And I think even before we start, Sherri, I would just get people excited because so much is possible. You know, some people are like, oh, I have osteoporosis or I have to exercise for my bones. And it becomes sort of a negative for them where it's so positive and so much can happen just with this exercise piece. You want to share before we even get started, just a few things that
Yes. I just really love tailoring an exercise program to the person in front of me. You know, no matter whether you've never exercised before, there are certain things you can do, some very fundamental skills that you can get under your belt to help you prevent fractures, prevent falls, and start to increase your bone health. Even if it's just a simple thing like learning how to do a hip hinge, standing on one leg, maybe reaching overhead. Maybe those are 3 things that you start doing right away. And then if you're a really fit person, so say like me and Margie, we love to exercise, but we want to be doing the right exercises too that are going to stimulate our bones. So we may start at a much higher level doing barbell training, strength training, and things like that are going to be a lot more challenging. So it doesn't matter where you are in that spectrum. You can always do something to improve your bone health.
Yeah, and that's what's so exciting. I don't know about you, Sherri, but I would have people come in, you know, again, they dreaded it and they just had to do exercise because the doctor said they have osteoporosis. And so, but then years later, they are so empowered because they're strong and they're fit and they've never had more energy in their life. Their bones have gotten better. It's just such a win-win when you incorporate exercise into your life. And just like you said, it doesn't have to be all of a sudden. That's the beauty of it. But all of a sudden you look back a couple of years and you're thinking, oh my gosh, this was a blessing in disguise. So it's just so great. But what have you done with all the people that you've been working with over the years in terms of, you know, what's happened when they do these exercise programs?
You know, there's something I read recently about the molecules of hope that are stimulated when you exercise and when you contract your muscles that help with depression. And I bet you've talked with your group about this. But, you know, working on your posture, opening your chest, working on thoracic mobility also opens your heart and really influences how you feel. And I love that, because a lot of times when people start doing that, they feel a little bit vulnerable sometimes. And then when they start getting used to it, they feel much more confident. And it was like their posture influenced their way they felt about themselves. So I love that aspect of it too, not just the exercise because you have to do it, but exercise that makes you feel good and makes you feel good about yourself too.
Yeah, it's such a win-win. And the other thing is there's so many options. It's not a lot of times people will read one paper and like, oh, I have to do that exactly. No, you have to enjoy what you're doing. You have a good sign somewhere there.
Yeah.
Where's your sign? Want to say what that
choose
says?
Happy. Yes, choose happy. You want to choose the thing that makes you happiest. And so my goal is always to, look at that person in front of me. What is it that you love doing? What brings you joy? And let me help you keep doing it, whether it's golf or tennis or pickleball or whatever it is that they enjoy doing. If it's yoga or Pilates, let me find a way to help you do the things that you love. Even if it's maybe somebody that wants to, I had somebody that really loves roller skating and they have low bone density. It's like, whoopsie, could we get you some hip protectors? There are some great hip protectors out there that are built into some little bike shorts and they're very stylish and useful. And then you could wear some wrist guards, so you do have to decide what those risks and benefits are. And if it's something that you love doing with your family, then maybe there's a way that we can help you do that.
Yeah, I think that's so important. And both of us have seen improvement in bone density, which, it's so exciting when someone comes back with their scores and it's just a win-win for everybody.
Yes, I have had multiple people come back and go, yes, I've incorporated better nutrition, I've incorporated exercise, and the exercises that you've helped me do within a year, they're seeing 1%, 2%, up to 6% in bone density in a lot of the people that are working with us. And the nice thing is that we don't see fractures. So I've seen maybe 1 or 2 fractures, not during the exercise, but because of an inadvertent action that happened, in their life. And that's what's been so great. Doing the program, even virtually, has been so successful and injury-free.
It's so exciting. And people don't realize that even at whatever level they are working, they're improving their balance, their posture, all these things that are going to prevent falls. There's just so many benefits to doing this. So exciting.
Yeah.
Before we get into some specifics, do you want to just briefly, because both you and I like to teach what works, and we don't want people wasting their time. And that's what's so nice that, we're very much into the research on what's been effective. So you want to just share some of the latest research papers or what you'd recommend people look at? They want to get more of an idea of what's gone on in the research?
Yeah, one thing I want to mention is that I was involved in the production of the guidelines for physical therapists who treat osteoporosis. And that was published back in 2022, but I don't think I've been on the podcast since then. So that has been published, and we now have guidelines for pre- and postmenopausal women who have osteoporosis for the types of exercise that are beneficial. So that's exciting for those physical therapists out there who would like to look at that for ways to treat their patients effectively and safely when they have osteoporosis. The other paper I love to mention is one by Koshi, and I'm going to pick that up and show it because it is absolutely the best paper I have ever read that is great for the lay person. So Koshi 2022 is a systematic review that compares a lot of different types of exercise. And they look at aquatic exercise, swimming, vibration, high impact training, strength training, yoga, Pilates, body pump. There's all different kinds of exercises that they're comparing. And again, what they're finding in most of the research, every paper that I read leads to strength training, high intensity strength training, and impact training. So what I love to, recommend to people is don't jump into trying to do impact and strength training immediately. You have to establish those fundamentals and those foundations first. But if you want to read a paper that is so effective at giving you all the latest information and summarizing it so well, it's really easy to read. It's well written. It's not complicated. I think that that is such a great thing to do. Another paper I love to recommend is one by Benedetti, and it was published in 2018. And it's another summary paper. It's not a systematic review, but it is a beautiful review of the literature up to that point. So it's getting a little bit old now, but Koshi's paper did a great job, and it's a much more detailed, analysis of the literature. But I love those two papers for people to take a look at. And then I also want to mention a few papers on impact training that showed benefits for both men, premenopausal women, and postmenopausal women. And I want to give a shout out to Christine Snow back in 2000, who was the first to start jumping with postmenopausal women. She did the weighted vest, not while they were jumping, but she did the weighted vest exercises for strengthening the legs. And then they would take the vest off and do jumping off of a Reebok step. So as you see, I've got my Reebok step back there, or it's an off brand, but I get one of those step platforms, and we start with about 4 inches and then progress up to the 8 inches in the women in my program. And they're doing great with it. And I also have a really good recommendation for a progression towards impact training, so that you don't literally just jump right into that and hurt yourself. So I always like to build that foundation first before you start doing those loading or dynamic exercises.
Sherri, I love that, because so often, and I see this all the time, you read something and, you hear about good success or this person. So what exactly did you do? They ask their friend. And it could be high intensity, and it could be, or whatever strength training it is. If they don't have the fundamentals, if they don't have the posture, if they don't, if they're not stabilizing properly, whatever it is, it could do more harm than good. And I don't think people realize this, that it is a progression. You just don't say, okay, this worked, I'm going to just do it. It's so much more involved with that. And I think as physical therapists, we both know, because we both deal with injuries. So we know what's necessary to do this safely. And that's why I love your programs. And I love what you work on first, so that there isn't there isn't any injuries, there aren't any injuries, and people can progress with this. And you want to just share a little, well, let's just tell people what we're doing, because I am,
okay.
Let's just tell people right now, because I am so excited. Sherri did an amazing class with my community. It was an intermediate yoga class, and it was fabulous, for osteoporosis. So it was safe and effective and really wonderful. But then there were people who really hadn't had the basics, and we decided that, what, let's do, because people wanted also the basics. They had to make some modifications because, they just hadn't had the basics in terms of fundamental exercises, knowing what to do. So Sherri and I decided that we are going to do together a 6-session class. It's 6 weeks. I'm starting October. It's going to be on Wednesdays, Eastern time at noon. I think it's the 2nd or 3rd, whatever that Wednesday is. Mm-hmm. But you want to tell
the first week of October, I think, is what we agreed on.
Because we wanted to share something easy, not too expensive, that people can get involved with.
Yes. One of the things that I started doing years ago in my clinic when I was teaching live classes was that I would have these classes. I had, exercise for bone building, and people would come in and they would exercise, and they would be with me for 2, 3, 4 years. And then I would get new people coming in, and they didn't know anything. They didn't know the terminology. They didn't know the main basic skills that they needed to have in order to perform the exercises both safely and effectively. But main thing was safety. And I was always focusing my attention on the new people that were trying to incorporate the new skills. And the other people who were trying to build their bone density and progress were kind of getting left by the wayside, and they weren't really progressing. They were kind of starting over every time a new person came in. And so they were staying in that fundamental basic level, and they needed to be progressed. So I separated the classes and developed an introduction to the fundamentals or the essentials of exercise for osteoporosis. Oh my gosh, that completely revolutionized my programs. It made the teachers happier. It made the students happier. It was a chance for us to really delve into the fundamental skills for alignment of your spine, reaching overhead, shoulder pain, neck pain, knee pain, hip pain, foot pain. We go through the whole body. Each class focuses on a different part of the body, and we can really help you focus on those areas that are barriers to exercise. Because a lot of times I can't press overhead because my shoulder hurts. I can't do squats and lunges because my knees hurt. Well, these fundamental skills will help you realign your body and your bones for better biomechanics so that you can start to eventually load those bones in an effective way to build your bone density. So we're actually going to do that program together and take you through all those fundamentals and essential skills. I like to say essential skills because you need these for every kind of exercise that you're going to do, whether it's a sport, yoga, Pilates, you're doing resistance training at the gym, body pump, whatever it is that you're doing, a dance class. These will all help you be more aware of your body, more aware of your posture, and more aware of your overall mechanics as you do things, your functional activities in life and in any activities that you like to do for recreation. So I am so excited that Margie is hosting this course. So
yeah, we just sort of decided after the yoga class, we were talking to people in the community, what they really want. And we realized so many people are missing these basic, I guess basic or essential skills. And what I always like is because some people say, okay, well, what should I do? What shouldn't I do? And then you aren't the knowledgeable person. You aren't in control. You have to wait for an exercise instructor to say, oh, well, Sherri said I can do this. No. Once you learn and you know how to operate and you know how to do things safely for your body, you can take any class and you'll know what's safe for you and what isn't safe for you and how to modify. So it's just such a powerful thing to learn. And then you can use that into your life. So I'm so excited about that. But Sherri, you're going to share so many good things. I really want everyone.
Yeah, I want to share something else too about that because a skills checklist is so great for those that are more advanced, possibly to say, okay, I can do that skill. I can do that skill, right? I can do my hip hinge. I can lift a box with 10 pounds in it. I can lift a box with 40 pounds in it because that's a skill that you need to do before you do impact training or something like that. So that's a way more dynamic. So you have this little skills checklist and you go, oh yeah, I'm not great at that one yet. Or this one causes me pain. You make a little note and say, that's what I'm going to have to go back to. And so that way the people that are more advanced can skip, they can kind of clip out on that skills checklist. They're good with that. And then they can move forward into more of the dynamic or high intensity exercise. And that way, you know where you fall in the spectrum and you know how to progress. So there's always this foundation of the most basic movement to the most advanced movement, which I kind of incorporate in all classes so that your basic movements count as a warm up for the more advanced movement. So you're always getting those basic reviews as you're warming up. So doing the hip hinge, for instance, I'd love to show that if you want me to show the hip hinge.
This is so important.
I can't do a session without that.
No, we talked about it, that we want all of you to get some things out of the podcast also. So yes, this is so important. Every single thing you do. Okay, Sherri, hip hinge.
All right. So say you have shoulder pain and when you try to push something overhead, your shoulders hurt and you're ending up like this, right? With shoulder pain. Well, if you can do the hip hinge with your 3 points of contact, then that's going to be...
Wait, stop. Just explain the 3 points of contact to everybody.
Uh-huh. Yeah. The head, the mid-back, and the tailbone are against an imaginary wall. So I think of this like the portable wall. This broomstick is like the portable wall. You can also go in your home and go against a door frame. So let's say I'm going to open this door right here and I'm going to stand against this door frame. And then it can give me that feedback against my body without my butt kind of getting in the way. Because if you stand against the wall, you get kind of pushed away from the wall. So standing against a door frame is a great place to do that. And then you are here. But here's what happens. What happens if your head is here and then when you put your head against the stick, it's too far away, right? Or it's like you're looking at the ceiling, right? That's going to be bad for your neck and not great for your shoulders too. So here's what you do is you can take a little pool noodle, got this at just like Target or Home Depot somewhere, I don't know, and put it on the end of your stick. So I got to take the little stopper off of it. And you put this on the end of your stick. And this one's a little bit thicker than most pool noodles, so you can see that. And it fills up the space so that when you put your head against the stick, and if you do have a forward head posture, you have a filler there. Because I think that's the biggest complaint that I see with my students who have a little roundness in that upper back is that head gets pushed forward or the head doesn't actually touch the stick. And then you need something to fill it up. So you could wrap a washcloth or a hand towel around it, but this is a really nice tool to put against the stick so that it fills up that space and you get that feedback of your head position. So then, if you find that when you stand here, you can't get your head to the stick because your back is stiff or rounded, then my favorite tool to get is just a ball. So I have a very soft ball and I have a hard one. The soft one, this one is the one of those that blows up with a straw. It was called a Gertie ball, but they call it all kinds of things now, but it's very, very soft. So if you're sensitive and you've never done this before, this one's a good one to start with. So you would just put it behind your back, sitting in a chair, and then place your hands behind your head. And then you can start to arch your back. And you're trying to keep your neck elongated. And you think of eyes under the collarbones looking in the same direction as the eyes of the head. So that is just fantastic for anytime you're sitting at a computer or in a chair where you're reading or doing something that's very mundane, then put this behind your back. I also travel with this ball, and so that I can do exercises with it, to promote thoracic mobility. I can open my arms up as it's behind me like that. And if you don't have a ball right now, you can roll up a big towel and do that. Then when you are ready to progress, you try to do it on the floor. So you would lie down on the floor and place it behind your back. And then you have to be careful how you're getting down because you don't want to curl your back more so and roll down. So you would want to plank downward, place your hands behind your head, and then arching back like that. And notice that my neck is not moving. So I keep my neck very still and I'm not lifting my chin. So if you put your thumbs right under your skull, those suboccipital muscles should be lengthened and relaxed. And so if you're lifting your chin, you'll feel those tighten up. And you can do a little bit of abdominal work and promote thoracic extension. You're going to avoid the curling forward, of course. And then when you can tolerate the small ball, you progress to the larger ball and the firmer ball. And you can always customize the ball because you can put less air in it if you're sensitive. And then as you progress, you put more and more air in it so that it is more, I hate to say the word aggressive, but more strong in the effect on bending backwards in your spine. And I think that's such a great way to help you mobilize your spine. And guess what? That's going to make it easier for you to push something overhead without getting that shoulder pain. Because sometimes we think we need to stretch our shoulders, but it's really our back that is the issue, right? So here versus here, all I did was straighten out my back. And so I love to work on thoracic mobility to help with neck pain and with shoulder pain, because if you're rounded forward, look how compressed my neck gets. And so that can be a fix for both of those things.
Yeah, I just want to say, and this is so common. Once we make people aware of it, or once you're aware of it, just start looking around or at the gym. And, I always feel so sorry for someone. And I want to just say, wait, just go, improve. But Sherri, you have a good name. You taught me the name for those exercises. You want to share it?
Yeah. Oh, yeah. The HR program.
Yes.
The hump reduction.
The hump reduction HR program, because nobody wants that hump. Oh my gosh. And
right. Exactly.
The good thing is there's research about this, right, Sherri? There's research about reducing.
Yes, Wendy Katzman, our dear colleague, Wendy Katzman, who did so much research on exercise for the reduction of thoracic kyphosis at UCSF. She's retired now, but she's still publishing. She's still involved in finishing up papers, I think, from when she was at UCSF. But she has published some great research on stability of thoracic kyphosis with exercise. And one of the exercises she also recommends is a prone extension exercise. And I love this progression. And I don't think I've shown this one. to your group.
No, this is
that
great.
you place a pillow on the floor, and you always want to protect your ribs. I'm going to put some dumbbells down, but again, you don't have to use dumbbells right away. Just feel free to work with your own body weight at first. And you put your ribs in the middle of the pillow, place your hands under your forehead, draw your shoulders down and wide away from your ears. And you try to get as flat as possible before you start. You keep your pubic bone on the mat. And then a lot of times, people are used to doing either yoga or Pilates, and they're just automatically pushing with their arms to push themselves up. And what I want you to be able to do is lift your face away from your hands, looking at your thumbs, and keeping the back of your neck lengthened so that you don't do this, right? Because that's not thoracic extension. That's cervical extension. You're extending your neck. And so what I want you to do is move from your back, that upper back. And it's such a hard place for humans to kind of target. And then you got to place one hand against your forehead and use the bottom hand to kind of help you come up. That'll help with your mobility and with your motion. Switch sides, do a few on the other side. And you can stay with this exercise for several days or several weeks if that is where you're at. And then if you can lift both arms up, and notice that I'm just barely touching my elbows to the floor, and then I'm lifting only a couple of inches. And then keeping my elbows down helps me keep my neck lengthened and relaxed, because if my elbows come up like this, I feel like I'm doing an exercise, but I'm really not doing anything but lifting my shoulders toward my ears and contracting these upper traps. So much better to lift here and then keeping my eyes looking down. When you feel ready, then you can add a dumbbell. So I usually just get a water bottle or something very light. I could use even one of these little wrist weights here, but just imagine that you're using a small dumbbell. This one's kind of big, but you would progress upward very slowly. Then when you're ready, you add that second dumbbell. And you'll notice when you do your resistance that you don't go up very far or fast at all. So, once you add those two objects, so one water bottle, then two water bottles, then you get your dumbbells and you go to the 2-pound dumbbell, and then you'll have to use something very small to increase gradually as you go, because it is a lot of resistance for that part of the body. Then there are two other positions I really like to look at too, is that, can you lift your arms in this goalpost position? That kind of targets that mid-thoracic area. And then when you go down to this position, it's like Cobra or Swan from Pilates. You lift your hands instead of keeping your hands on the floor the whole time, because that's an arm exercise, right? But to strengthen your back, you have to lift your hands up, and then you go up and down, and you're keeping that neck lengthened, eyes looking down. You don't want your eyes looking way up, compressing your neck as you do it. So those are some of my favorite exercises for helping to strengthen your upper back and deal with that rounded spine posture.
Hey, Margie here. High-quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional-grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements for less. And you'll get to my FullScript store, and in there, you'll see my favorite bone-building supplements. So make sure to check it out, and the link will also be in the show notes. So let's get back to the show. Yeah, and the interesting thing about that is, I know when I was working with people one-on-one, as a physical therapist, people were doing biceps and people were doing triceps, but what was really lacking were exercises for the spine, which is so important. The bones respond to the forces placed upon it, and we need to get those forces and the extension. So I love those. How do you have people start, Sherri? How many repetitions of people who are watching this?
Yeah, so I usually keep people between 8 and 15 repetitions of everything. So I want you as a beginner, if you're just starting this program, you start with at least 8 repetitions. So if you cannot do 8 repetitions of something or you get pain with it, then you have to back down on the weight or the difficulty or the range of motion of the exercise. You have to make it a little bit smaller or a little bit less intense. And then once you can make it to 8, you start progressing until you can do 15 in a row. Once you can do 15 in a row, you've gone past the bone building category. You're in more of the endurance training zone. And what you want is to make sure that you stay between 8 and 12 repetitions, which is most effective for building bone. And then eventually you'll even go less than that. But you start with 8 to 15 as a beginner. Once you get to more of the intermediate category, I think of that being like maybe 6 to 8 repetitions is your target number. And then for the advanced category, you're going to do 5 sets of 5 repetitions for any strength training exercise. So you as you see, you get higher on the weight and lower on the reps. And we know that from Belinda Beck's research on the Lift More trials, that's what those women did. Now, I take a lot longer to progress people to that level. And because I'm not trying to do a concise research study, right? This is lifelong. And so I'm thinking progress is progress. 1 pound is progress, right? So you don't have to rush to try to get, a lot of weight because it's all relative. Your bones don't know the difference between, 1 pound and 20 pounds if you are getting to fatigue within that small number of repetitions. So again, it's higher number of repetitions as a beginner, lower number of repetitions and higher weight as a more advanced student. So I usually like to tell people that are intimidated about doing this program is spend a year just doing body weight exercises, alignment exercises, precision, core control, foundational principles. Enjoy that. And your bones will probably respond to that because you're doing something new, which is called novel stimulus. And then the second year, you might start adding more resistance to your program. And then the third year, you might consider adding impact to your program. And that will be like jumping type exercises. For more advanced students, this might be 3-month progression. For a beginner student that has never exercised before, that may have had some issues with frailty, that might take 3 years. So it's just a progression of body weight, alignment, body awareness first, resistance training second, dynamic impact training third. And I think of those as a progression. And you want to make sure your skeleton can handle what you're trying to do with it.
So important because, oftentimes people just jump, as you said. They'll just say, okay, that worked, let me do it. And then they get hurt or they're doing it, with rounded posture and different, and that's not what we want. We want safety and progressing. And that's how we get all these great results without increasing pain or problems. And that's what we've seen. Can you show, there's a couple of things I want you to show, because you showed me this before, and I love this you created, Sherri. I thought it was so good. What you created for the people who really can't do any kind of overhead lift, press because it hurts them. You want me to share? You created something so smart. I hadn't seen this. It's called the dog.
One of the things that that I used to do as a PT is I would avoid doing overhead press with patients, and I would have people kind of avoid it. And it's been a theme throughout a lot of the world. And when people come in, they're like, no, I haven't done overhead presses in a long time because that hurts my shoulders. So if you do an overhead press with these 2 5-pound dumbbells, it's a lot of work on the deltoid, and it can be a source of what we call impingement of the shoulder. And so when you're rounded like this and you try to do an overhead press, you are more at risk for impingement. And one of the things that is a goal for building bone is to lift as much weight over your head as you can. And so I like to think, I want to make that as easy as possible for the person to be able to lift something overhead and to get them to the point where they can lift a barbell overhead, right? So like this one. So what I do with people who maybe are not ready for a barbell or don't have one is that you can just take a dog leash or a yoga strap, something firm. It shouldn't be a TheraBand. It should be something firm that doesn't stretch. And you wrap it around the dumbbells, and then you press overhead. And the whole time you're doing that, I'm going to kneel down here so you can see better. You're pulling apart. And what it's doing is it's decompressing the top of that humeral head against the acromial shelf there. And it's also decreasing the use of the deltoids because you're pulling apart and it's giving you support. So therefore, you can lift weight overhead to stimulate your spine, which is what we're trying to do if we're building bone density, with less shoulder pain and less difficulty. And then the other tip I have for this is when the bar passes your head or the strap passes your head, your elbows should be bent to about 90 degrees. If you're wider than that, it's going to be really challenging for your shoulders. And also, if you're more narrow than that, like go backside, if you're more narrow than that, that's really tough on the shoulders too. So I feel like the magic place for an overhead press is 90 degrees of elbow bend when the bar or the strap or the dumbbells are right over your head, right there. So you can always know where to place your arms by that position as you pass your head. And you can play with that too. You can have it a little bit farther apart, a little bit closer together and find your happy place for your shoulders. The one thing too about the strap is that you don't have to have your hands locked into that barbell position, right? And that does affect the shoulders too. You could have the dumbbells facing each other, palms facing in, which rotates that humeral head back a little bit and is easier for a lot of people to do an overhead press. So again, I'm trying to make it as easy as possible to do an overhead press. So you can get as much weight as possible overhead and stimulate your bones. And then last tip is when you do your overhead press, don't stop before you get to full extension of your arm. Your elbows should be nearly locked. And that way you really feel the load going through your spine. And because if you stop here, it's like you miss out on that little moment where you're stimulating your spine. So I think you should get those arms all the way straight, stay there for that magic victory moment, and then come down. So it would be an inhale, exhale, stay, inhale to lower, exhale to lift, stay. Yeah. And so those are my tips for people that have a difficult time with those overhead presses.
You know what I realized we didn't talk about? Let's just talk about the precautions, the absolute, because if someone, the people who have heard us know this, but maybe there's someone who doesn't know exactly. So you want to just share what are the things that we really have to be careful about? You've sort of mentioned them. Maybe just let's again so everybody knows for sure.
Yeah, the day you find out you have osteoporosis, you need to start thinking about protecting your bones before you ever start building bone. I always want people to think about how am I going to protect my bones from fracture? And so one thing that people tend to like to do when they wake up in the morning is, round your back, touch your toes. That seems to be a barometer for health. Not a great barometer for health. The best barometer for health is being able to get up out of a chair or get up off the floor by yourself, without any assistance. So you don't want to round your spine forward like that. You certainly don't want to round and bend. You don't want to lift anything with a rounded back or perform any activities with a rounded spine. Then that includes things like on the mat, doing, sit-ups and crunches and yoga poses and things like that, where your, feet are over your head, you're standing up on your shoulders. And I can show you a couple of little pictures here. Here's the rounded spine here. And then you don't want to be doing, things like deep twists. I'll show you another exercise for the rounding. There's one here, like the lifting the head. You want to keep your head down. This is the plow or the rollover in Pilates. Certainly not a great movement to do. This is the saw in Pilates. Certainly don't want to do that. And
wait, before you continue, I just want to tell everybody, Sherri designed these sheets. And they are just they were really
so great.
They're my favorite. They're just so, and we'll give you the links. They're on Sherri's website. You want to tell everybody, I'll put it in the show notes, but it's just, want to tell everybody how they get these?
Yeah, you can go to the TheraPilates.com and just on the homepage, there are links to information about osteoporosis. So you can just click osteoporosis information there and get and download both of these. There's one for yoga, and one for Pilates, and some of the contraindications and precautions about what you need to avoid if you do those kind of exercises. The reason I made those is because those two types of exercise have the most prevalence of contraindicated movements, because they're really focused on moving the spine to end of range in both of those methods. So what you want to do is don't go to end of range in your spinal movements, and especially not like deep side bending and no bouncing to end of range, rotation, not using your legs to twist into deep forms of rotation. And it's certainly not, rolling over and balancing all your body weight on this mid-thoracic area, doing a plow or shoulder stand, a rollover, things like that. And so that's why I made those flyers, because I wanted you to know that you can do yoga and Pilates if you like doing that, but you want to avoid those really risky exercises that are going to put your spine at risk for fracture. And there has been some research on fractures with doing extremes of flexion in yoga. So Sanaki published a paper, and Spear also published a paper on that.
Yeah, so it's so important, because unfortunately you'll go to a senior exercise class and they're doing all of those things. And it's just, they're doing the windmill. That's even worse, bending forward and rotation.
Right.
And so it's something that, a lot of people, we think, we're in this world, but people really don't know. A lot of the doctors don't. It's just not common knowledge. And so when you did that, I just have to kudos to you. You did that quite a while ago, gave it to the National Osteoporosis. Now it's the Bone Health and Osteoporosis Foundation. You didn't care if you got any credit for it. You didn't care at all. You just wanted to get that information out. And that's gone all over the world, Sherri. I mean, those...
Oh, great.
Really is.
I'm glad.
I tell everyone, take this to your instructor. But anyway, we'll give you the links for that in the show notes as well. But those are just so good.
You can get those in the Bone Health and Osteoporosis Foundation. They do have them in their resource guide for exercise. But the one thing I want to tell people about extension is that, a lot of times people avoid extension because they think it's bad for their back. Well, we do everything in life forward. Like everything we do is forward. Reading, writing, working on the computer, sewing, knitting, watching television, eating, everything we do is forward. We don't do anything backwards and through extension. And so a lot of times people avoid extension. And that's actually safe to do, because that bone is not susceptible to osteoporosis. It's a different kind of bone. Here's your spine. These are the trabecular bones that are the cylinder-shaped bones that are at risk for fracture when you bend forward. If you bend back, you actually open those up and you put the load on this compact bone at the back of your spine, which is cortical bone. And so the people that have stenosis or some other kind of diagnosis might need to be careful with that. But what I always say to them is that you don't have stenosis at every segment in your spine. It might just be at L5S1 or L4-5, or maybe just a couple of segments down low. You can still work on thoracic mobility up above those segments. And that's actually going to help decrease the force in that lower segment. So don't be afraid to try to do some spinal mobility directed to where you have that roundness in your back. I think that's important to think about too, because I know there are people that have more than one diagnosis and comorbidities, we call it.
Yeah, we could go on and on, but I do want you to show, if you don't mind, on the summit. Sherri's been on all my summits, always voted the #1 best talk also.
Oh, thank you.
Because so many people no, it's really true. So many people are doing yoga, and we'll have that class too, because that class is now an on-demand class for people who want a really fabulous intermediate yoga class. But the other thing, could you just show, because a lot of people always ask, well, what's the problem with Warrior One? Because I know on your, and they look at you, I've made you do this different times, but
I know.
It's on your sheet to avoid, I think it says avoid Warrior One. And people always ask, well, wait, what's wrong with Warrior One? Can you just show people the modification? Because
it's not necessarily contraindicated for osteoporosis, and I probably should take it off of there, but I'm going to use my bell
because it's important. People could get hurt.
Okay. Yes, I think so. So, okay, here's Warrior One position here. So you've got front foot is pointed straight ahead, back foot is pointed out at a 45-degree angle. Okay, With Warrior 2, let me just start with that. You're basically, I could put this dowel across my back like that. You're as if you're against a wall. Your pelvis is pointing in the same direction as your shoulders, and it's biomechanically accessible to most humans. Okay, now, what I'm told to do with Warrior 1 is to keep my back foot planted and start rotating my pelvis toward the front and get both pelvic bones aimed toward the front here with the back foot planted down. And so what happens a lot of times, people run out of hip range of motion, and then they end up bending the knee, collapsing the back foot, and pronating that back foot. Of course, I wouldn't have shoes on if I was doing yoga. But and then they're asked to bring their arms up and lift up. So look at that compression that I have on my low back. I'm at risk for really twisting and tweaking my knee, and I'm also overpronating my foot. So I get people like that in trying to do this pose. And I just don't know that it is so beneficial that you need to be doing stuff like that, because there's so many joints at risk, and it's almost biomechanically impossible for most humans to do it. And so I prefer to have that back foot parallel, and then you get your hip extension, and you get this wonderful preparation for walking so that you can continue to take long strides, because hip extension is what's precious in the human body. We only get 30 degrees for our lifetime. And if we lose any of it, we end up being here and then trying to walk without any hip extension. That's what happens, right? So you want to always preserve that ability to extend your hip. So I just say, keep that back foot parallel, do your warrior pose like that. And I like to call it Warrior 1.5 because it's kind of a cross between Warrior 1 and Warrior 2. And it's a great preparation for my favorite yoga pose, which is Warrior 3. So that balancing, back extension, leg strength, everything. But you don't want to get there right away, right? You can prepare for that Warrior 3 by doing that Warrior 1.5 or that, some people call it high lunge or runner's lunge.
Yeah, no, that's so great. Thank you so much for sharing that.
Well, you're welcome.
Forever. Is there anything else that we missed that you really want to share with everybody?
I wanted to kind of summarize how you would put together a well-rounded yoga, Pilates, strength training program. So, or just an exercise program. Like, what you need to do realistically that doesn't take hours at the gym. Like, you don't need to go to the gym for 2 hours every day to build your bone density. So what I would suggest to a person who just wants to have a healthy lifestyle is make sure you get a brisk walk in every day, even though it's not going to be enough to stimulate your bones. Get a brisk walk in every day. It's great for your mental well-being, great for your heart, and great for management of your sugar levels, right? So if you have a meal and you do a walk afterwards, such a great idea. Why the Europeans are so healthy, they walk to dinner and then walk back home. So I think a brisk walk every day is a really great benefit. And I think a 20-minute fast walk is probably minimum of what you want to do. And I always tell people try to walk faster instead of farther so that they're, getting their cardiovascular system challenged. And they're also increasing their stride length, because when you try to walk faster, that actually increases your stride length. But just walk at the pace that you feel safe at. And then that being said, then get in 2, and I always say shoot for 3 days a week of resistance training. And if that is just managing your own body weight at first, doing like a single leg heel raise, maybe you need assistance at first. That's okay. Doing your hip hinge squat, right? Getting that in your body. So even if you're just practicing this right now, working on your alignment, getting a box, putting things in it, lifting the box, 3 sets of 10, right? Doing proper alignment with lifting, practicing that deadlift. That's one of the best exercises you can do for everything, your pelvic floor, all the way up through your whole spine, your legs, everything. And then really making sure that, you start to incorporate those other exercises eventually, like an overhead press, your back squats, your lunges, things like that. And then that's minimum 2 days a week, really shoot for 3. And then those other days, maybe you want to do some other exercises that you love, like yoga or Pilates. You could do that once a week on an alternate day. You could play tennis. and you might take a Tai Chi class, right? So it's really great to have that 1 or 2 days a week where you do something recreational that's not so structured, right? That you just can have fun and move your body and have a friend that you're working with. So that's kind of the bare minimum for what I think that people should be doing and trying to achieve. And then keep it into a routine where you're doing it at a similar time every day or meeting with a class. We have virtual classes that you could join if you want guidance with your exercise program. That's always really fun because then there's accountability and, you have that structure of that meeting time.
Oh, that's so great. And also just about, both of us are physical therapists, and physical therapists can, a lot of people just say, oh, I have to live with this shoulder pain, or I have to live with this. See a physical therapist, and they're a physical therapist. Do you want to say anything about that? The best way to...
Yes. That's been my joy, is that I love to work with people who are impeded by exercise because they hurt or they have, a knee problem or hip problem. I hear every day, not just in my PT practice, but in classes where people are working on proper alignment and strengthening, that, focusing on strengthening a joint that is in pain is actually really helpful. And, if you are in a situation where you don't know what to do, please reach out to a physical therapist. They can either, help you locally. If you have a physical therapy clinic locally that you can go to, that's always the best option. And you can also reach out to people who do virtual physical therapy. And I do that as well. So I do one-on-one consultations with people. And I am even surprised by how effective I can be virtually with people, especially when you can film the whole session. They get the recording of the session and they can get feedback on exactly what I'm saying and how I'm helping them. That has been probably the silver lining for the pandemic, is being able to realize how much people can benefit from virtual physical therapy without me ever laying my hands on them. And it's actually more empowering to them because they really have to fix it. I give them the tools to fix it, but they actually have to fix it. And that's been fantastic. So I can't say enough. I would never, ever regret. I don't ever have one day of regretting becoming a physical therapist. It has just been the most amazing experience, being able to heal people daily.
Yeah. And I think people don't realize, just too many people think they have to live with it. And I'm like, no, see someone. You do not have to live the rest of your life with this. And a lot of times doctors just don't recommend seeing a physical therapist. So I think it's so important.
Yeah. And in most states, you can reach out for your own consultation. You don't have to have a referral from a physical therapist. Now, if you're on Medicare, you do need a referral, but it's not that hard to get. I'm sure that if you requested that from your physician, they would be happy to write a referral for physical therapy if you're in the Medicare age.
Oh, well, thank you so much, Sherri. This has been so helpful. So we're very excited. So there's lots of things. So we have a really great class coming up. And if you're watching this and it's over, you'll be able to access it, the on-demand. If you can do it while it's live, we also answer questions afterwards. So it even gives you, more opportunity to interact. But it will be there regardless if it's, if you're listening to this a year from now, the class is still available. It'll be available online, an on-demand class. So that I'm really excited about the fundamentals. I think that can help everybody, regardless where you're at. Adding these fundamentals will be great. So I'll have the link for that. And then Sherri, tell everybody about your community. You have a fantastic community as well.
Yeah, we have our virtual class format where we offer a class every day except Sunday. And we have different levels. We have a beginner class or an introductory class where you can actually meet with me one-to-one on Fridays. And I say one-to-one because there's usually less than 5 people in the class. And they each get to tell me what kind of issues they're having. And I can, counsel them and give them some advice and try to help them along the way if they're having an issue, or just introduce them to the equipment that they need for the class. So whatever it is that they need to get them started in the program, that class is on Fridays, and that's open to anyone. And then the intermediate classes are without the heavy resistance training are on Monday, Wednesday, and Saturday with teachers Michelle and Jenny, and they are fantastic. I got so many compliments on them every week. And then my classes for the strength training, with the heavy resistance training, we do box lift or barbell lift, whatever it is that you have. I show all kinds of ways for you to add resistance so that you're doing, maybe you're lifting a dowel with some TheraBands tied to it, or you're doing the dumbbell with the strap between, like I showed. And maybe you're lifting just the lightweight box at first. I show you multiple ways to participate in that type of class, no matter what equipment you have at home. And then you can join that class for, a la carte. You can drop into those classes. You can observe the classes if you wanted. And then there's a monthly membership that you can access everything. That's an unlimited membership that you can have access to any live class or any of the library classes. So every class that we teach gets recorded and goes into the video library so that people that are members of the video library program can access that. So we have live classes, we have the video library, and we have a combination of the two. You can have either one or combination. So we hope to see you in the program.
Yeah, no, it's all so good. So thank you so much, Sherri, for just updating us and sharing these great exercises that can make such a difference. And just for everybody, is there any last minute thing you want to say? Because this has just been so wonderful.
Just thank you for what you're doing and how you're just doing an amazing job at spreading the word on safe exercise. And, like I said, all things bone health. I appreciate you, my bone health bestie.
Well, thank you so much, Sherri. This has been great. And everybody, just get out there and just start wherever you're at. And we do have these wonderful resources available. So hope you will join us, because I think I'm so excited, Sherri, that we're doing this. I can't wait.
Me too. This is what happens when we get together at these conferences. We start coming up with all these ideas of ways to collaborate so we can see each other more.
Yeah, absolutely. Anyway, thank you so much, Sherri. It's always a pleasure. And I can't wait till October till we begin these.
Thank you.
I hope you enjoyed my interview with Sherri as much as I did. The exercises she demonstrated are fabulous and can really make a big difference for your bones and overall health. I am so excited about the new class that we're going to be doing together, the Osteoporosis Exercise Essentials. It's 6 sessions, and we will do the program, and afterwards, Sherri and I will have Q&A as well. So I think it's going to be a great experience. I really do hope you can join us for that. All the information will be in the show notes, as well as the information on the on-demand yoga class. It's an intermediate level that she did for my program that people really loved, as well. And also Sherri's classes that she has on a regular basis. So thank you so much for tuning in, and I look forward to seeing you on the next episode.